Hello everyone, this is Kant Shah here, Paediatric laparoscopic and robotic surgeon. Today I'm going to talk about big scars to small cuts, how laparoscopic surgery has changed pediatric surgery. A lot of parents cannot comprehend sometimes when we talk about laparoscopic surgery. What does it actually mean to the child and how small a scar are we talking about? Today I want to talk about how laparoscopic surgery has completely changed the game for pediatric surgery in terms of survival and quality of life. To begin with, pediatric surgery is a very new branch. Surgery is more than a few thousand years old, but pediatric surgery is only 100 years old. It was mainly because anesthesia was not developed and hence children could not tolerate surgery without anesthesia. So it was not being offered to them. Most children who were born with life-limiting problems would just die naturally. Even an organ like a kidney, which would have a swelling, that organ would die naturally and there was no surgery offered to such children, even for the first few years after pediatric surgery was started. In India, pediatric surgery is about 70 years old. But laparoscopic surgery has actually been adapted by pediatric surgery almost 25 years back. So pediatric surgery as a specialty has struggled a lot to get the right care for children and enable their survival. But when laparoscopic surgery came, we adapted very quickly. In fact, 25 years back, pediatric surgeons were already doing very high-end laparoscopic surgery. This is because laparoscopic surgery is better in almost every way compared to traditional surgery. Parents are really worried about the size of the scar. So what scar sizes are we talking about? Well, if you do an appendix surgery in a 4-5-year-old child, then you're talking about a scar which is at the length of my hand. And if I do it by, say, laparoscopic surgery, I'm talking about 3 cuts of 5 millimeters. So we're talking about 5, 5, and 5. And if I do a surgery on a newborn baby or even a 1 or 2-year-old baby, then I'm talking about 5, 3, and 3. So they are really tiny cuts. They are not really actually cuts, they are just stabs. So the tensile strength of these wounds after a few months is far superior. It's to the square of the size length of the scar. So if you understand a bit of mathematics, it's really much stronger. So the later complications are much lesser. And this also has a psychological effect on especially teenagers because the body image problem. So it is almost like a small mosquito bite sometimes or a chickenpox scar. So somebody can get away without looking like they've even had surgery. In addition, a lot of parents are concerned whether the child will go to school and be able to play. Yes, every child goes to school within a week of even major surgery, a week of discharge. And most of them will start playing sports within a month or 2. So the recovery to school and play is much faster in laparoscopic surgery, giving much less psychological and emotional stress to the parents because for them the long-term effects of surgery are more important than just what we do at the time of surgery. For me as a surgeon, I am on a journey when I am trying to not just learn laparoscopic surgery, teach laparoscopic surgery, but also imbibe whatever new technology the companies throw at us and see how we can use those like 3D technology, 4K technology, image guided technology, and many more which will keep coming, and use all of those to see how we can make the slight change from survival to quality of life for children, and which actually the parents feel it is the largest change that laparoscopic surgery has brought to pediatric surgery. So thank you for watching this video. Please keep watching and liking and subscribing.